Imagine a virus that can kill up to 3 out of 4 infected people in some outbreaks, and it doesn't choose one target. It attacks your lungs and your brain. The worst part? It enters like a thief, quiet, patient. You just touched a doorknob, then rubbed your eye. All right. No myths, no movie logic, just the countdown. T plus 10 minutes, the first latch. If the virus reaches the moist surfaces of your throat or airways, it looks for door handles on your cells, receptors found in blood vessel lining and nervous tissue. And that matters because Nipah doesn't just infect tissue, it can turn your blood vessels into the battlefield. Right now you feel nothing. No pain, no warning, just normal breathing. Subscribe now, because on Dark Truth we break down extreme biological threats second by second inside your body so you know what's real before it's too late. T plus 1 hour. Replication begins inside your cells. The virus hijacks your machinery and starts making copies. Your immune system isn't asleep, but it's blind at first. It needs time to recognize the pattern. So Nipah expands locally, then prepares for the next move. It wants access to your highways, your blood vessels, your lymph, your organs. T plus 24 hours, the bloodstream gamble. If Nipah spreads beyond the entry site, it can start injuring the endothelium, the delicate inner lining of blood vessels. That lining isn't just plumbing, it's your pressure regulator, your leak prevention layer, and your oxygen delivery control panel. When it's damaged, vessels become inflamed and leaky. Fluid escapes where it should not. Clotting signals misfire. Tiny vessels can narrow, spasm, or clog. This is how a virus turns circulation into a weapon. T plus 36 hours. The vessel leak cascade. Your endothelium is supposed to be smooth and quiet, so blood flows without sticking. When it's inflamed, white blood cells cling to it, platelets activate, and tiny clots can start forming in the smallest vessels. That does 2 things at once. It blocks oxygen delivery to tissue, and it forces the body to burn through clotting resources trying to patch microscopic injuries. Now imagine that happening in the lungs. Every blocked capillary is one less place for oxygen to load into blood. Imagine it in the brain. Every swollen, irritated vessel is a spark for seizures and swelling. This is the double hit Nipah is known for. Damage the pipes, then starve the organs. And here's a nasty detail. Your body tries to compensate. Your heart beats faster to push more blood. Your lungs breathe faster to pull in more oxygen. But if the exchange surface is flooded, all that effort is just panic with physics. Still, you may feel fine. And that's why Nipah is psychologically dangerous. It gives you a false sense of safety. Day 4 to day 14. The normal flu trap. For many cases, the incubation period is commonly 4 to 14 days, though longer has been reported, up to about 45 days. So days pass. You go to work, you share air, you share rooms. You tell yourself, if it was serious, I'd know by now. Then it hits. Fever, headache, muscle aches, sore throat, cough, difficulty breathing. At first it can look like a routine viral illness, but inside your body is heading toward a fork in the road. Fork. 1. The lungs begin to fail. Inflammation swells your airways, immune cells pour in. That sounds helpful until the inflammation becomes the damage. Your lung air sacs are supposed to be thin, dry membranes where oxygen slips into blood. Inflammation thickens that membrane. Leaky vessels add fluid. Now oxygen has to cross a swamp instead of a tissue paper wall. Your blood oxygen starts dropping, quietly. Your brain reacts first, faster breathing, faster heart rate, rising panic. Your body is screaming, "We are running out of oxygen." But here's the twist. Low oxygen doesn't just make you weak, it makes you confused. Confusion delays help. Confusion is a multiplier. Fork 2. The brain becomes the battlefield. Nipah can cause encephalitis, inflammation of the brain. This is where the takeover becomes literal. As inflammation rises, pressure inside the skull increases, but the skull is a closed box. so your brain starts getting squeezed by its own swelling. You may notice severe drowsiness, disorientation, a blank wrong feeling, seizures. And once severe neurological disease begins, the drop can be fast, sometimes to coma within about 24 to 48 hours. Now feel the POV shift. You try to speak. The words don't line up. You try to stand. Your balance lies to you. You try to remember a simple fact, your own date, your own name, and your brain stutters. The person in the room is talking, but your mind is lagging behind the sound. The body's internal countdown, hour 0 of severe encephalitis. Thoughts start breaking apart. Hour 6, signals misfire. A seizure can hit like a power surge. Hour 12, swelling presses the deep control centers that regulate breathing and consciousness. Hour 24, you can slip into coma because your brain can no longer keep the lights on. And while this is happening, your lungs may also be failing. So you get hit from both sides. Oxygen drops while the brain swells. Now you're in the emergency room, and the clock gets cruel. Minute 0, your oxygen saturation is falling. You're still talking, but you're working for every sentence. Minute 5, a mask goes on. Your chest muscles start burning from the effort of breathing. Minute 15, your brain starts buffering. You answer late, forget mid-sentence, stare at nothing. Minute 30, if swelling or seizures begin, your body can jerk against itself like a short-circuited machine. Minute 60, the team isn't fighting a virus anymore. They're fighting the cascade, low oxygen, leaky vessels, brain inflammation. That's why this infection feels like a takeover, because it steals your ability to think clearly, right when you need it most. Pattern break. Even if you survive the crash, the story might not end. In some survivors, late onset or relapsing encephalitis has been reported. Months later, brain inflammation can return, the fever ends, but the risk can echo. Why Nipah can be so deadly? Your survival depends on 3 things. 1, oxygen getting into blood. Stable vessels delivering that oxygen. A brain that isn't inflamed and compressed Nipah can disrupt all 3. Fast. So what stops it? Here's the hard truth. There is no widely available, routinely licensed vaccine or proven specific antiviral cure for Nipah. Treatment is supportive. Keep oxygen stable, manage fluids, control seizures, treat complications early. In real time, that can mean escalation, nasal oxygen, then high flow, then a ventilator if lungs fail. At the same time, clinicians fight brain swelling and seizures, because a swollen brain plus low oxygen is a countdown you can't negotiate with. There are experimental options under study, including a monoclonal antibody used in limited emergency contexts, but it's not a guaranteed rescue button. So prevention matters, because the first battle is avoiding entry. Avoid food products that could be contaminated by fruit bats. Reduce contact with sick animals. During outbreaks, reduce close contact with infected people and follow strict infection control precautions in care settings. And here's one more uncomfortable truth. Your body isn't the only battlefield. Your breathing can become a transmission engine. When the virus is active, it can be present in respiratory secretions and other body fluids. Caregiving without protection, sharing utensils, wiping saliva, handling vomit, staying in a small room, can turn one case into several. Now rewind to the moment symptoms begin and tighten the clock. Day 1 of symptoms. Fever isn't just heat, it's your immune system flipping the alarm switch. Chemical messengers surge, your heart works harder, you feel wiped out because energy is being diverted to the fight. Day 2. If lungs are involved, breathing becomes the limit. Every breath becomes work. You may feel like you can't get enough air, even as you try harder. Day 3. If the brain is involved, the most dangerous symptom isn't pain, it's confusion. Confusion makes you underestimate the threat while the clock speeds up. The scariest part is the calm. With many deadly infections, you get a warning shot. With Nipah, the early phase can be quiet. Then the disease can accelerate into respiratory distress and brain inflammation that can progress fast. That's the takeover. Not a dramatic moment, a biological siege. If you want the next layer of dark body science, tap the next video. Remember, rare doesn't mean harmless. It means you won't see it coming until you're already on the clock. Stay sharp, stay informed. Subscribe now.